Hi guys. Um, Sorry if it's I know it's a weird setup. You are balanced on a roll of toilet paper with a hotel-sized lotion to keep the phone level. So I know it's a little precarious, and we're in my bedroom, and I'm standing, and the lighting's weird, and I'm sure the sound is weird. But it is what it is. I just wanted to film this quickly on my phone, and I just wasn't putting it off. It just hasn't happened. So I was in Nashville for the weekend, and it was so much fun. And the day before I left for Nashville, I had an appointment with the new rheumatologist, and that's what I wanted to talk about, was that he did, in fact, give me a diagnosis. Yay! So very short recap. I've been having a lot of symptoms for about 7 or 8 months, and it is mostly pain, mostly symptoms that would have been caused by chronic inflammation, very high inflammation. So that is everything from extreme pain in my joints, my muscles, fatigue. I've been having massive amount of hair loss. I've probably lost about 40% of my hair on my head now, and some just really bizarre, seemingly unrelated but very related symptoms. And then I developed some more symptoms, such as Raynaud's phenomenon, and more recently extreme carpal tunnel syndrome, which I have had carpal tunnel syndrome since I was about 13 or 14, but I've never experienced it like this, so much that I have not slept more than 2 hours a night in about almost 3 weeks, because my hands and my arms just hurt so bad that it keeps me awake, and nothing seems to help. I sleep with splints on. I take a massive amount of anti-inflammatories. Doesn't help. Anyway, so yeah, last week I saw the new rheumatologist. He was great. He was sort of a dreamboat, which helps. But he listened to everything. He went over my whole list of symptoms that I provided him. Hold on, I'm just gonna grab a sip of my water. Sorry. Because it's on my phone, I don't want to have to edit anything, so you're gonna get all the doggy taps and all the coughs and all the water drinking, so I apologize. Okay, so I do have a couple notes here. I promise they're pretty small. I just have a hard time remembering medical stuff, because who can remember it? So here's what he told me. He told me about mixed connective tissue disease, or MCTD. I've just been calling it mixed connective tissue disease. I know that it sounds sort of vague, and as you guys know, I have Ehlers-Danlos syndrome, which is a connective tissue disorder. And this sounds very familiar, but it is very different. So a mixed connective okay. So a connective tissue disease is an autoimmune disease such as lupus, rheumatoid arthritis, scleroderma. I think there's about 5 of them, major ones, I'm sure, but there are all kinds of branches of those. But there are 4 or 5 major ones that are considered the connective tissue diseases. which are systemic inflammatory rheumatic diseases or autoimmune diseases. So, this whole time I was sort of under the impression that I had lupus because that's what all of the signs were pointing to. And it turns out that I do have lupus, but I also have some of these other autoimmune diseases. So what the mixed connective tissue disease means is that you have multiple of these rheumatic autoimmune diseases. So yeah, that means that instead of having to say, I have lupus, I also have rheumatoid arthritis, I also have scleroderma, or this one's hard to say, polymyositis. I'm sorry, that one's hard to say. There's a lot of isises in there. But that one I do have. That one is muscle weakness and muscle pain, which I have been having. I haven't, okay, so overlap of two or more. So you can have two or more. It doesn't mean you have to have all of them. He, I believe, confirmed that I do have the systematic lupus, polymyositis, and the rheumatoid arthritis. I haven't shown any signs of the scleroderma yet. Excuse me. I don't think that I will ever get that. If I do, I don't think that it will be able to present itself. That is only like a wild guess because scleroderma causes like thickening and hardening of the skin, and it does that by like overproducing the collagen and sort of sending collagen too much into one area. And Ehlers-Danlos is actually a lack of collagen, which is why it makes your skin stretchy and fragile. And so I feel like it would be very bizarre to have EDS and then also have scleroderma, sending too much collagen when my body doesn't have enough to begin with. So I feel like I could maybe get some sort of symptoms of scleroderma, but not the hardening and thickening of the skin, which I hope does not happen because it looks terrible. And I don't mean like, oh, it's ugly. I mean like it looks very painful and I don't want it. So there are a few differences between having lupus and having lupus as well as these other things. In that, like, lupus is known to go right for the kidneys or sometimes the liver. And when you have the mixed connective tissue disease, when you have multiple of them, it actually sort of changes the course of what like organs it goes to first, which to me is sort of good news in that I don't really want renal failure or major kidney disease. However, instead of the kidneys, this goes to the lungs first. So I am not looking forward to that. I had a couple numbers of what they know of statistics, and that is that MCTD is rare. I don't know how many out of how many people have it, so I do now have 2 rare diseases, so go me. But of the people that have it, I think 96% are female, and that it comes on around age 37. I am 36, so that's spot on. 90% of the people who have MCTD have severe Raynaud's, which I now have. 50% will have esophageal dysfunction, which I believe I am in the start of. I've been having a lot of trouble with like my gag reflex, in that I am having a very hard time swallowing pills, which I need to take more pills now. And it's like this 30-minute process of like just nonstop gagging and trying to get the pills down every night. So that's fun. 50% will develop lung disease, and that's the one that I am not very excited about. There's no like nice way to be sick, no nice way to die, but I have always said that like the worst would be like lung stuff, just like drowning in your own fluid in your own body. Does not sound fun, but I'm gonna cross that bridge when I come to it. I have had a lung x-ray recently, and it looked pretty clear from what they can tell. But I have a lung function test in about 2 weeks. So that will show if any of the lung stuff has started or not. So, fun. And then only 10% will develop kidney disease, which is a lower number than if it were regular lupus, or, lupus nephritis, which is lupus of the kidneys. And then 10% will develop neurological damage. I didn't read too much about that. 10%, I'm thinking I can handle putting that off for a while and learning all the scary stuff. So what can they do for it? Nothing, pretty much. They did put me on lupus medication, which is called Plaquenil. I started that the same day as my appointment. That was Thursday, so I've been on it about a week. Apparently that takes anywhere from 3 to 6 months to kick in. So I won't notice, if I do notice any benefits from it, I won't notice for some time. That is frustrating, but that is, it is what it is. I am also back on the prednisone currently, just for a week, because I was crying to the doctor, telling him I can't sleep because of the carpal tunnel, and he said that might help, so we're trying that first. And last night was the first night that I slept about 4 hours straight, so maybe it is helping. But I've been on it about a week, and I'm supposed to start tapering already in a day or two. So I don't know if I should continue on now that it's just starting to help, or if I should start tapering, but I'll decide that later. The prednisone, unfortunately, also gives me really bad sleeplessness. So I'm taking it so that I can sleep through the pain, but it keeps me wide awake. So, it's a trade-off. I don't know what I'm gonna do about it. But dog's so cute. So I guess that's like the whole update. Yay for a diagnosis, right? Boo for it being everything. I wanted him to tell me the one thing that I had, not that you have everything. But it is good to know what I'm dealing with, and good to know that nothing currently is severely damaged. I'll find out about the lungs, and he did a bunch of other blood tests that are, I've seen the results and he hasn't. They don't look good, but they don't look worse than the last time I got him tested. The urine sample looked pretty nasty, but I don't know what any of it means, so I'm gonna wait till he tells me that stuff. And yeah, so I guess that's all of it. I have been, I don't know, I was gonna say I've been feeling a little better. I'm not really sure that's true, or if I'm just sort of getting used to it. No, I think the prednisone for sure helps me a little bit with just like the overall pain. And I have recently sort of realized that with things like this that have flare-ups, when you're in a flare-up, it's like your brain has no other thing to think other than this is it. Like, this is life now. This is what it's going to be like for me every day. Like, oh, I can no longer walk. I can no longer close my hand. I mean, I can't bend this finger past here. And it's like, okay, this is it now. Like, that's just it. I'll be laying in bed or in the bathtub if I'm lucky, and I'm thinking, like, I guess I have to quit my job. I can't go to work. I can't do any work. I can't see anybody. I can't clean my own house. I can't take care of my own dog. Like, this is it. I have to make all these accommodations now. And that's, can you see her? Haha, this chai. And it doesn't matter if you tell yourself, like, this is temporary. You'll always be sick, but you won't always be this sick. Like, every day won't be as bad as this day. And like, you can logically know that, but it doesn't feel that way at all. It feels like that's just how it is. I mean, even when you get a cold, right? You're like, I can't breathe. I'm just gonna be like this forever. I'll never breathe again. Like, you've forgotten what it was like to be healthier. So I sort of just came to the realization that I need to promise myself not to make any life decisions during a flare-up. I didn't, by the way. I didn't make any big decisions or mistakes, but I literally, like Joel came home from work and he was talking about how the guys at work were joking about moving the office to Florida. And I was miserable, and I thought, okay. I said, okay, well, you know that I can't work. I can't work while we're there, and I won't be able to do this or do that, and we got to make sure that we find a single floor place to live. He's like, we're just kidding. We're not moving to another state. and I knew, and we don't ever plan on moving like that. But it was just like all these thoughts of like, well, if this is what my life is like now, if this is what my health is like, I don't care where we go, because I can't do anything anyway. I can't work. I can't keep my job. I can't get another job. I certainly can't work a job where I'd have to be on my feet. And it just like, I realized that, like, I need to not have those thoughts or like make any of those sort of decisions while I'm in the middle of a big flare-up, because right now it's still new. I don't know what a flare-up consists of. I don't know if this is as bad as it's gonna get, or if it's gonna get worse, if it's gonna last longer, if it's gonna be less, if the Plaquenil kicks in and all of a sudden I'm like I was before, which is in rough shape, but manageable. I have no idea. And it's hard to think ahead when you don't know, when the good stuff is going to be and when the crappy stuff is going to be, like this Nashville trip, which was amazing. But it was like the worst timing. I didn't know. Half a year ago when we booked this, I didn't know that I was going to be in this state. I didn't know that I would need a cane to get around and that I would need to, you know, take a car everywhere we went, even though it was a quarter mile down the street. I didn't know that. And now it makes me scared to book things for the future because I don't know what sort of state I'm going to be in, if I'm going to be able to do those things. You know, and I need to think about all that, and I need to come to terms with that and figure out what works for me the best. I have to say, another random new symptom that's just like the past week is that it literally feels like my tongue is too big for my mouth. Like when I talk, it's like I keep biting it and it feels like I can't keep it in my mouth. I don't know if that's a thing. I think it's just because, you know, I went away with a friend and we talked the entire weekend and just talked and talked and talked and talked. So I kind of think maybe my tongue's just tired or something, but I don't like it. I feel like if I open my mouth, it's just gonna like shoot out of my mouth and I'll never get it back in. Okay, so I rambled for 20 minutes, but I hope that some of it made sense. Thank you, everybody, for sticking with me so far on this like journey of a diagnosis. I am sure that I will have all sorts of updates for you as we figure out more. In the meantime, I'm gonna keep taking my pills and I'm gonna go cook dinner, and I hope that you are all doing well, and I will show you this awesome lightning bolt necklace that I got in Nashville that makes me like an immediately cool country star or something. I don't know. It's cool. So that's it. Sorry, I'm distracted. Yvonne is chewing on something. So if you're real lucky, I could take you over to see the doggos. Nope, she's leaving. See, what are you doing? Let's see if there he is in his bed. I know that all looks like a mess. If you saw my like bedroom tour, that's like the gym area. And I promise it's not quite a mess. It's actually quite organized, but it also hasn't been used in some time. So yeah, I need to figure out what kind of exercise I can do because I'm kind of going nuts, not doing much of anything. So there it is. And there's C. Hey, buddy. Oh, the floor creaked. Now he's spooked. So I'm gonna go down and cook dinner, and thank you for listening. If you made it all the way through, good for you, and I will talk to you soon. Bye.